Hey guys, Dr. Ina and Dr. Maha are here today. The topic of the day will be the Quantum Wellness Academy. What is it? It's a super exciting thing that we would like to introduce because this Quantum Wellness Academy will be actually the answer for two major questions. For people who actually looking for the alternative way of healing their body, which is the Biofield biofeedback technology, or the other big question would be, what do I do if I'm so tired of the profession that I am doing right now, or I'm retiring and I want to do something with our time, with my time. So that also going to be an informational website that will lead you, and if you choose to become a biofield practitioner, it will actually teach you how to become one. So Dr. Maya is also an educator and extremely interested in topics of the energy therapy. So she will tell you her experience and her vision in regards to Quantum Wellness Academy.
Thank you, Dr. Ina. So yeah, I studied holistic medicine. I'm an internist, but I always was interested in alternative modes of therapy that gives the patient options. Everyone knows that modern medicine, allopathic medicine saves lives, and its its philosophy is based on chemicals, right? Chemistry, so drugs. And the truth is, and it's undeniable, drugs have side effects, and sometimes they work, sometimes they don't. And it's good only when disease has been, progressed so far. So there is a serious lack of ability for preventive medicine that is not invasive and does not add a load of chemicals in the body. Energy medicine is not new. The old civilizations know about it. We just have a new name for it. So, for instance, acupuncture is a form of energy medicine. It's based on the understanding that the body has energy currents like rivers, and there are certain points you go and you activate it. That's the principle of acupuncture. There are a lot of research that has been done on color therapy, which is a form of energy medicine because that's energy. Everyone knows about red light therapy now, but there are a lot of other wavelengths of color therapy. The ultraviolet, remember the ultraviolet machines that were sanitizing the places for during the COVID time? So actually we use it, we just don't call it that name. There is vibrational medicine, there is acoustic, which is using sound waves to break stones, lithotripsy. We use ultrasound for diagnostic purposes. So we already do in modern medicine use the concept, but we just don't call it that.
Yes.
Right? And no one is really used to, I don't want to say it, but generally people are not used to the idea of using these modalities for actual treatment, right? People are comfortable with it for diagnostic reasons and for breaking stones, but they don't take it seriously as to really, as I love how you put it, bringing the body back into resonance. So there is a lot of technology out there, and each one of them will focus on one field of this energy medicine. And the bioresonance that you have works more on a combination of electromagnetic, correct? The
Yes.
Thera, and the other one is based on informational level.
Correct.
And I do agree, I'm very happy that you decided to come up with this academy, because when I was doing my research, there's a serious lack of a structured curriculum that is methodical and scientific to teach people the principles of it, how to do it, how to implement it. So I'm very excited that you decided to do that. Can you tell us what are your thoughts? What are you going to do about it? How do you think you're gonna present it to the people?
So I've been doing the bioresonance or biofield therapy You can call it both. In Europe, it's a common term as bioresonance. In America, it is more common to say biofield, but you know, it is pretty much the same thing. It's just a game with words. But I started doing biofield therapy 5 years ago, and as I said and shared before, it started with my dog. You know, she had urinary bladder stones, and she had the surgery twice. She had some medications and everything, nothing helped. And she's been accumulating those stones again and again, even though we changed the diet and did everything what the doctor said. And then someone offered to do the holistic treatment in the form of bioresonance, and we did it for 2 weeks, 3 times a week. And you want to call it miracle or something else happened, but the stones came out and they never reappeared back again.
Wonderful.
So that was a wake-up call for me, because I was like, okay, it helped one soul. Why don't I start learning it and, you know, help myself, my family, and my patients, my chiropractic patients? Because at the end of the day, chiropractic is also an energy treatment through hands, you know. So because if we go back to the history of chiropractic, it all started with energy therapy. I was very cautious on not introducing patients to that type of therapy, but actually it was kind of like working for statistics and see if the case with Nikki, my dog, was not just a coincidence. And I practiced for a year and a half on multiple patients with multiple complaints, and I started noticing that a lot of their complaints were just going away without experiencing any side effects like what medication can give us. And then I realized that love helping patients in healing process, and then few of my patients asked me, is like, can I learn it? Do I have to be a doctor to learn that type of therapy? And fortunately enough, it is not regulated because it's not a medical device in America. It's considered to be a wellness device, so anybody can practice it. But the only thing is, obviously, you have to have passion and love for people.
And patience.
And patience. And understanding that if you are taking responsibility on yourself to help someone, you can't just quit it in the middle of the road.
True.
So, and slowly but surely, you know, a couple of my clients or patients became practitioners, and they started building their own practice and their own following. And it made me so happy to see everybody get together. You know, a couple times a year we were gathering here in this clinic and exchanging experiences, and and it was such a great energy because everybody was under the same roof, but the journey was to help and educate yourself.
Yeah.
So, and then I decided, it's like, okay, we'll get together, we share experiences. I go to Germany once a year to see a bigger, you know, medical community who is practicing bioresonance, biofield. But then what can I do is to attract more people and to attract a bigger following. So my understanding was, I'm going to create an academy online, work on protocol, work on the certain steps that if someone wants to become a practitioner, they're supposed to take it seriously.
True.
Because it is a responsibility, you know, people are seeing clients. Doesn't matter if it's a free client or a paid client, it's still a person who is sharing a lot of private information with you. So even though you're not a doctor, but you have to think like one.
Yeah, you're like a healer, right?
Yes. So in this academy, I believe that it's not only learning how to practice the device or how to use that device. You have to think.
Yes.
And you have to know the energy, you have to know the anatomy, you have to know the physiology, you have to know a lot of things in order to become a great practitioner, because the machines are amazing. The technology exists for so many years. One of the technologies called Mars 3, it's existing for 70 years. Thera is about 40 to 50 years. So it's not something new.
Yeah.
But what's new is the approach, the approach and who is practicing it, who is behind that machinery. The whole point behind this academy is to create more people aware of the devices, the opportunities that right now are presented, becoming a practitioner and creating their new either hobby or work activity, and also to be structured.
Yes.
Obviously, it's not a diploma.
Yeah.
It's not going to be counted somewhere in the city for now. We never know what can happen years
True.
later.
Yeah.
But it's not about hanging a piece of paper on the wall. It's about becoming a true practitioner with a good knowledge, with a deep knowledge of not only the operating the machine, but the whole field of energy. And the whole field of energy is so broad.
Yes.
That
it is. It's confusing sometimes.
We can learn for years and still think that we don't know enough. But the basic stuff, and combining with the physical anatomy and physiology and what the body is in terms of the physical level and energetical level, is very important. So that's pretty much my my wish for this year, to make this academy stable, strong, and grow with years. It's not a competition. Obviously, it's we're not in a hurry. We just want to build a nice, stable, online educational platform that people who are interested to join, they will have this ability.
Yeah, and I think this would be good for people who are in the medical field and they're looking to add another service.
Yes.
Whether they want to expand to have integrative modalities in their clinic, or they want to move more from clinical. I mean, there are a lot of doctors and practitioners who are burnt out and they want to move away from clinical to something that has to do with wellness, but it's real. It's good for people, as you said, who have no medical background, and because this is not considered a medical device, so it's open for anyone who has a passion for it. And I think the introductory course that you're giving, which would be just education about energy in general, I think anyone who wants to start taking care of their health should get it. Because as you said, there's so many options, right? There's so many options out there. And for somebody who's saying, okay, I want to start exploring like alternative medicine, they don't know where to start because there's just so many options, right?
Yes.
So this introductory course would be an education as to what is energy medicine, what are the modalities that are available, what are these many machines or techniques or something that is out there, and that way they will know, like, okay, I resonate with this one, this seems to be something I'm more interested in. And the training would include scientific studies and like evidence that how it worked and what is the principle,
facts, right?
History facts. So I think it's an excellent idea because I have not seen anything like that out there, to be honest. It's good,
And God willing, if it will be supported and we will grow at a particular speed, then you never know where it can take us.
Yeah, I know.
Because I'm sure there are a lot of people who are practicing bioresonance, biofield, and they want to share their experience. So there is always a room for creating seminars and educational modules and webinars. So I'm very open towards people who have comments or they want to share some information on it. So we will attach the name of the website and the Instagram. Please follow us. I'm very, very open towards any suggestions or any comments when it comes to improve that field and make it bigger. So thank you for listening, and give me thumbs up. I'm waiting for your comments and have a great day.